Hi, can you guys hear me? I'm very bad with microphones and clickers. Okay, so I might drop it like 3 times. We'll see what happens. My name's Terri Pollack. I'm a nurse practitioner at University of Miami Sylvester Cancer Center. I've been here, this is my 12th year working as a nurse practitioner in medical oncology. Dr. Hossein, who you met this morning, is the doctor that I work with, and since Dr. Chauhan and Misty came, I help them. He says a lot. I help them a little bit, just a little bit. They know what they're doing. So I am a family nurse practitioner. When Sasha says call our office, we're teammates. You will get our assistant or our triage nurses, and then they will decide what calls go to me, what calls go to the nurses. But also in the clinic, I'm typically the person that comes in your exam room first. Or if we're doing telemedicine, I will come on the Zoom first, go through what's been happening since we last saw you, find out if you have any new side effects to your regimens, or if you have any new symptoms that might make us think we have to make some changes in your plan to make sure that you don't have progression. I also prescribe as a nurse practitioner. I have my own clinic where I can see people that are doing really, really well and or people that might not be. In addition, I'm also a psychiatric mental health nurse practitioner, although I do not practice as one at Sylvester, but it's another form of education that I have. Mental health was one of the topics that was offered to us to speak about, and I said that I would do it. So Sasha did a fantastic job, but hearing about the drugs, did that stress anybody out at all? Yes? Do you mind if I ask who said that? Because I can't see. Okay, so there's been a few things mentioned throughout the day today that tie in with stress and mental health. Earlier this morning, Dr. Anthony spoke about serotonin. Did you guys know that stress can actually increase serotonin levels? Yes. And it could be the tiniest little stressor. And sometimes when I'm going over the labs with my patients and we see that their serotonin level jumped up, I ask them, hey, was there anything going on a couple of days before you had that most recent lab test? Because in the moment when we're talking about it, they're also stressing because it's been bumped up. And I've had people tell me all different kinds of things. Oh, Terri, I didn't even think about that. And then we calm down because we found the potential reason why that serotonin might have been up. So mental health and net diagnosis. The first thing also that I like to say is that when we talk about mental health, I'm not implying anybody's crazy. Mental health isn't come, sit, lay down on my couch, tell me about your childhood. Mental health in oncology is encompassing what's been going on. You just had a diagnosis, or you've been living with a diagnosis that rocked your world, right? Actually, let me go back. So we know that a cancer diagnosis can negatively affect many people's mental health, and many of you are probably sitting here and inside your head, yeah, you know what, that happened to me, and even my diagnosis made my spouse or my kids, have some anxiety. So we create like new barriers when we're already suffering from mental health when we have a cancer diagnosis, but then also other things that have been in the past can bubble up. People might not even know that they had anxiety. And even if you're not struggling with an actual mental health issue, the stress of the cancer diagnosis can cause acute strain and vulnerabilities. Think about even individuals that you might know that have been diagnosed with a different kind of cancer that had substance abuse or especially like alcohol abuse, and especially during the pandemic, many people started to drink more, especially if they couldn't get out of the house to go for their treatment. Top is our brain on the little graphic, and then this is actually some pathology slides of neuroendocrine tumors. So the uncertainty of illness, besides myself and Misty, is anybody else in the room a nurse? Okay, oh, all right. So I don't know if you guys or know about Merle Mitchell. When you're in nursing school, you pick a theorist and you study that theorist and do all kinds of papers. And Merle Mitchell was a nurse from North Carolina, and her theory was the uncertainty of illness. NETS is a perfect diagnosis to match up with uncertainty. From day one, wow, this is rare, I'm the zebra, what is going to happen to me? It's all so uncertain, correct? Versus if you Google lung cancer, non-small cell lung cancer, it's all laid right out there for you. We have here our paradigm, and there's a tool called the RUIT that Dr. Mitchell created that helps individuals work through the uncertainty, and you can plot it out. Did I go too far? Okay, emotions are normal. So when we talk about our mental health and emotions, we know that sometimes we have flares, sadness, euphoria. I'm losing control of everything that's going on. Last week, I was a CPA taking care of all types of accounts, and this week I have cancer and I don't know what I'm doing. Depression, panic, feeling very isolated. I've heard stories from patients where they say, you know what, most of my friends I used to hang out with, they don't want to hang out with me. I hear this with my younger patients, especially, that, because I can't, go out for a cocktail really anymore, because of the fatigue from the treatment. A lot of my friends just aren't around, and I feel very isolated. Add on the whole piece of having a cancer diagnosis during the height of COVID, and that additional isolation, anxiety, and distress. I stole this Venn diagram from Sasha. You can see on your left, distress. Distress can be emotional, it can be mental. There's a lot of social distressors and even spiritual suffering. Got anxiety, a very uneasy feeling of dread or fear. These are probably things that many of us in this room have felt in the past. And then again, the sadness, loss of control, etc. When it comes to anxiety, anxiety disorders can involve more than temporary worry or fear. If you're just, at the gas station and you realize you didn't have your credit card, that little bit of anxiety because you can't pay for the gas, that's going to go away. It's temporary. But having a cancer diagnosis and going through every day of what you have to go through, this can cause a lot of anxiety, and it's not temporary. People with these disorders, it can get worse over time as well. And this is really prevalent in the NET community, especially for the individuals with low grade, because you guys are living very many years living with this diagnosis. And so if you're having anxiety that's not temporary, that can be with you and get worse over a few decades. The symptoms can also interfere with daily activities. You have to go to work, but you feel very stressed out. It can affect your job performance, people that are in school. One of the stories that I've held on to for about 10 years is a patient who's still my patient, and when I first met her, she was so distressed and so anxious. She worked here in Miami for one of the major cruise lines in the corporate office, and she shared her office space with about 6 other individuals, and the restroom was right there. And she had carcinoid syndrome. Terry, I cannot go to work. I cannot go to work. I'm having 15 episodes of loose stool a day. And the door to the bathroom is right there. I can't go to work. I can't go to my son's soccer game and sit in my soccer mom chair because where am I going to go when I have to go? If any of you in the room have carcinoid syndrome, I'm sure that when you walked onto this floor, the first thing you did was you scoped out where is the bathroom. So this can cause so much anxiety, and it's actually one of the reasons I fell in love with NETS and the individuals with carcinoid syndrome, because I knew that we could help them and get those daily episodes down based on my knowledge of some of the treatments Sasha spoke about earlier. Adjustment disorder. So when you look at different diagnoses in the world of psychiatry, you guys have probably heard of depression, major depression, manic depression, lots of different types of disorders. Well, one of the most mild disorders is an adjustment disorder, and this is classified as a disorder where there's a life change, something's going on, and it causes additional stress and additional anxiety. And we can manage this very, very easily. We're running out of time, so I'm going to go faster. So counseling and activities can help people with adjustment disorders. Something like NCAN and the different groups, Marianne talking earlier about say hello to the person next to you, working it through conversation is one of the best things you guys can do in a non-formal setting. There's also counseling, and especially at our institution and most academic institutions and cancer centers, there's a department called Psych-Onc, where there are psychiatrists, psychiatric mental health nurse practitioners, psychologists, therapists, and social workers who can help you navigate the system so that you have a formal provider that you can work very closely with. Thoughts, feelings, behaviors. Think about all of those things that are going through your head. So there's been research and additional treatment modalities, protective factors, psychopharmacology. So Sasha spoke about the actual oral chemos, but there are lots of other drugs, and it's not that we want to push drugs on you for your mental health, but there are lots of other drugs that can be dosed very mildly to help individuals who are suffering from adjustment disorder or anxiety have better days and better night's sleep as well. Working on communication skills, problem-solving skills, and then support systems. And support services at a cancer center are all-encompassing and very important, and Giovanna and Anna and Missy will talk a little bit more about that. Those are actually Ativan, GABA on the bottom. And has anybody heard of lorazepam or Ativan or gabapentin? These are drugs that can be used. And then also, I've got another one there. They're actually them. Okay, so management, self-care. How many of you guys this evening, when this conference is over, are going to go for a nice dinner? You don't have to raise your hand. Okay, thank you. And or maybe tomorrow you're going to go for a massage. Or if it's not rainy where you live, maybe do some gardening. Tomorrow, I didn't have time, so tomorrow my self-care will be my manicure and pedicure. Usually I go on Saturday, but we're here. One of my other favorite ones, music therapy. That's also part of our support services department, as well as art therapy. Who does yoga? It's fantastic for this. If you've never done yoga and you're not the kind of person who wants to go to a class, you can do this at home. Many of the streaming services and or your cable company, if you go on the really high channels, you can find some yoga. I usually recommend that individuals start with chair yoga or even the pregnant women yoga or the senior citizen yoga. You don't have to do exactly what they're doing, but it's great for your mind and soul. The overall thing of exercise, this low impact, No, if you're running marathons, great, keep doing it. But if you've never done this type of exercise, you do not have to get your heart rate up. Just move, and this will help you to feel better. I left some blanks there. Anybody want to shout out what they like to do for self-care? Walking. Walking's one of the best things you can do. These guys will tell you, I always recommend to my patients, especially here in South Florida, where it's really, really, really hot, in the summer especially, and they tell me, oh, Terry, I just can't, it's too hot out. Guys, go to Target, okay? No, wait, who said it's expensive? I'm gonna teach you a trick. Go to Target, okay? Go to Target. It's air conditioned, and for people that get tired easily, there are 5 places to sit down and rest. Front right, Starbucks. Back right, shoe department. Back left, garden furniture. Front left, the pharmacy, and in the middle, that fashion furniture. Load up your cart. But when it's time to leave, the only thing you're gonna buy is you need a toilet paper. You could do 1,000,000 laps. You don't have to go fast. It's air conditioned, and they are not going to kick you out. Anybody else besides walking? So if you're not doing any of these, take a look closely at the list. Pick one. You don't want to do it this week, set a goal. Because again, this is your self-care, and this is your way of managing your stress and your anxiety. Set a goal. You know what? November 1st, I'm going to start doing this only 2 days a week, 15 minutes. That's all it takes. Resources at Sylvester, and again, my colleagues here will talk a little bit more about this, but we have, again, this department called Psycho-Onc. So we have a total department of psychiatry, but then we have a special group. They are fantastic. We have in the outpatient setting, psychiatrists, I listed them all out there before, and Giovanna is one of our social workers. And then on the inpatient setting, so none of you should ever wind up inpatient, but you know what? Let's say you went skiing and you broke your wrist, and you wind up inpatient because you have to have that surgery, and you're just really feeling down. You can ask for a consult with one of the people from our Psycho-Onc team at UM, and again, psychiatrists, psychiatric mental health nurse practitioners, and then because we're an academic center, there were fellows and residents who are on that team. Up here, we actually, myself and the nurse practitioner in pink, we presented at the American Psychiatric Association conference this year in San Francisco, and the drug in question for our poster was the CAPE in Cape-10. Capecitabine, Xylota. At the bottom is our team, not even all of us, because there were probably like 15 more that were at this conference. Community resources. There are a lot of community resources. If you're not from here, ask at the office. Marianne also can give you names of organizations that might be local to you. For psychiatric mental health, Catholic Charities, typically, if your institution doesn't have psychiatric mental health providers, you could always call up Catholic Charities and find out if in your county they have providers, and if it's a sliding scale, because that's also helpful, and also Jewish Family Services. I'm not pushing on religion, but these are known institutions. They're also sometimes through your Board of Education. There are opportunities as well. These folks won't be specialists in cancer, but especially if you live in a rural area, sometimes you have to take what you can.